Now I'd like to ask our panelists. We have a very important panel this morning. Nneka Jones, Tapia, Kelly O'Brien, and Karen Teitelbaum. And in fact, we already have a number of questions. But if you do have more questions, please fill out the blue slips that are on your tables. We'll try to get to as many as we can. And legibility definitely counts. That's very important here at the City Club. I'm going to introduce our panelists, and I will be asking them to speak for a short time, and then we'll get to questions. Our first panelist is Nneka Jones Tapia. She is the Executive Director of the Cook County Department of Corrections. As we may all know, the Cook County Jail is the largest one in the country. She assumed that role in May of 2015. She was the first Assistant Executive Director of the Cook County Sheriff's Office, where she oversaw the mental health strategy at the Cook County Jail. Sheriff Tom Dart has long decried the criminalization of mental illness and the cuts that have been made in service throughout the county and state. We have been incarcerating the mentally ill individuals who are routinely incarcerated for small offenses such as petty theft, panhandling, trespassing, prostitution, disorderly conduct, and other minor offenses. Prior to joining the Sheriff's Office, Dr. Jones served as the Chief Psychologist at Cermak Health Services, the on-site medical and mental health provider at Cook County Department of Corrections, where she developed and chaired numerous mental health programs and committees. Dr. Jones received her academic credentials. She's earned a bachelor's degree in psychology from the University of North Carolina, Chapel Hill, a master's in clinical psychology at East Carolina, and she has her doctorate of psychology from the Virginia Consortium Program in Clinical Psychology. Dr. Tapia.
Thank you. Thank you for having me, and I'm pleased to see a lot of familiar faces in the audience today. Is this microphone okay? About 1 in 5 Americans lives with a mental illness in any given year. And so that means that everyone in this room knows someone with a mental illness, whether it's a family member, a friend, a neighbor, maybe even ourselves. And when mental illness hits close to home, undoubtedly, we want the best possible care for ourselves or for our loved ones. So let me ask, how many of you in this room would voluntarily go to jail to receive that care? I'll wait. No hands. Unfortunately, so many people don't have that choice. About 2.1 million of them, to be exact. That's the number of people that are booked into our jails every year with serious mental illness. 2.1 million. Nationally, about 20% of inmates in correctional institutions are living with a serious mental illness. And sadly, in Cook County, we fare far worse. At Cook County Jail today, about 30% of our inmate population is living with a mental illness. And those are the ones that we've identified. That's more than 2,000 mothers, fathers, husbands, wives, daughters, and sons that didn't have that option that I just asked about earlier. I say those names as family members because so often I think we think of those that are incarcerated as the other, but they really are our loved ones, they're our neighbors, they are our friends. And until it hits home, so many of us so easily turn a blind eye to this crisis. Every opportunity that the individuals in our custody have had to seek treatment in the community was taken from them. So they're locked in that massive fixture at 26 in California. But fortunately for them, we have a sheriff whose mission is to right that wrong. Sheriff Thomas Dart said, please. Sheriff Thomas Dart said, I'm no longer doing business as usual. We can do better and we will do better. You see, in a well-run society, lawmakers and politicians understand that primary prevention and early detection are essential to overall well-being of the individual. They understand that there are ways that we can minimize one risk of developing serious mental illness through programs that focus on overall health, spiritual, physical, emotional, mental. Programs that increase resilience even in the midst of difficult circumstances. Because of Sheriff Dart and his advocacy, Cook County Jail has over 200 of those programs for our inmate population. Programs that effectively teach men and women how to be better versions of themselves. There should be a continuum of care in a community that gives, pride in the people that grow up in those communities. Treatment should be available for every individual, whether it's the person that has the most severe symptoms in need of hospitalization, and even those that are professionals living in the community that just need to talk to someone every now and then. Unfortunately, we have drastically reduced the number of state-funded hospital beds in our community. Illinois has just over 1,000 state-funded hospital beds. So we have more people in the custody of the Cook County Sheriff being treated for mental illness than we have state hospital beds in the whole state of Illinois. Saturated, depleted mental health resources have also, waged a war in this crisis. We have, enormous wait times. We have overwrought emergency rooms, which I'm sure my colleagues here will talk about today. But to make sure that we offer that continuum of care, Sheriff Dart made the tough decision. He converted law professional positions and turned them into mental health provider positions. He made sure that in partnership with CIRMAC Health Services, Cook County Jail offered treatment to every level of care and every level of functioning for individuals in our custody. And as our community has been closing mental health facilities, Sheriff Dart has been opening them. We opened 2 mental health facilities, one on the west side of Chicago and one in the southern region of the county, because the sheriff wanted to make sure that individuals leaving our custody continued to receive quality health care. We recognize that even when someone is released to the community, they may benefit from seeing a familiar face, someone to encourage them to persevere, even in the face of obstacles. So yes, we actually do have people that voluntarily come to the jail for treatment, but it's in a manner by which we welcome them. They're not brought by the police. They're coming to us willingly. They're healthy, they're smiling, they're working, they're educated. They receive their treatment in Cook County Jail, and they are welcoming to come back to the jail for our alumni programs and offering to serve as peer counselors, motivating each other. If Sheriff Dart can do all of those things in the largest single-site jail in the country, my question to this room and to our community is, why can't we do that in the community?
Thank you. Now I'd like to introduce Kelly O'Brien. Kelly is the Executive Director of the Kennedy Forum of Illinois. The Kennedy Forum is a state-based initiative of the national organization that was founded by former Congressman Patrick Kennedy. The Kennedy Forum's mission is to end stigma and discrimination against those with mental health and addiction challenges. By providing bold leadership, strategic partner alignment, and concerted action, the Kennedy Forum is driving the dialogue about transforming the mental health system and building the support to do it. Ms. O'Brien is also the founder and president of ID Action Corps, a full-service social change agency. ID Action Corps is a certified corporation and benefit organization entity in the state of Illinois. Previously, she served in a number of public health policy leadership positions, including acting as a public health advisor to Senator Durbin, a senior legislative aide for Congressman Jerry Kletzka from Wisconsin, as well as a congressional liaison in the Office of the Director for the Center of Disease Control. She received her academic training at St. Mary's College, Notre Dame, and has a master's in public administration from George Washington University School of Business. Kelly.
Thank you very much, and thanks, Nneka. It was great. It's really an honor to be speaking here today, and honestly, I'm a little humbled. I know there are just so many smart people in the room and in our state and nationally working on these very big issues, and I know this because over the last number of months, I've been on a mission to talk to as many of them as I possibly can. I have been listening and touring and trying to better understand the system. I've been drawing on expertise from members of the Kennedy Forum's Leadership Council, people like Sheriff Dart and Dr. Jay Shannon at Cook County Hospital System. We have State's Attorney Kim Fox and Karen, and so many incredible people that have been working on these issues. And I'm doing that in part because on your tables you'll see that on January 16th, of 2018, the day after Martin Luther King Day, we are hosting our 4th annual meeting, and the topic is on justice. So if you have questions when you ask them, I would love it if you have ideas of people that you'd like to see at that conference. If you don't mind, you can write it on that card and I'll collect those too. So we have a lot of work to do. The first point I want to make is that we should all be really uncomfortable having this conversation in the first place. It's got to be had, but just for a moment, I mean, imagine if we were talking about diabetes and incarceration, right? Or Alzheimer's and incarceration. These are all healthcare issues, just like mental health and addiction, but we don't lock people up because they have heart disease. This is not just a policy debate about budgets and about programs. It's a human rights issue. And what's really frustrating and really mystifying to me is the seeming lack of urgency and agitation and outrage about this, and about mental health and addiction in general. Many more people die from overdose and suicide in this country and in our state than from guns. I don't mean to downplay the importance of that issue as well. But overdoses are the leading cause of death for Americans under 50. Suicide is the 3rd leading cause of death for adults age 18 to 24. And it just feels like we're getting used to it. So as I was talking to people, I asked everybody, what do you think the issue is? What's the challenge? And what do we need to do better? And some of the more sort of systems issues that come up are all C's. They're things like better connections, better coordination, better collaboration, and community, right? So one of the things that I heard over and over again is we have a connection problem. So if you think about the path that untreated people take before they intersect with the system, call this point 0. And then maybe their first likely encounter with the police officer, and then jail, and then the courts, and then maybe prison, and then reentry, call reentry point 5. The biggest problem we have is at point 0. Nobody knows where to go. There's no centralized state hotline. There's no directory. There's no door. Other states have doors. New Jersey has a hotline. Missouri has a hotline, New York has 24/7 services, but not us, not Illinois. So, and then once you're on the inside, one thing that was just really surprising to me is, save one person, I won't say who it is, pretty much everybody that I talked to could point out something that somebody else was doing wrong. And it seems like, to me, when one perceives that one part of the system is not working, that the logical thing to do, of course, is to turn inward. And you just do the best you can in your own house. I mean, Sheriff Darter's done incredible things in his own house, right? But the problem is that when it comes for caring with people with mental health and addiction, we can't succeed if everybody's running their own race. It's more like a relay. I'm actually the 1985 Rosary High School state champion relay member. You can look it up. But we practiced the handoff. It was the baton, making sure that you didn't drop the baton. And we are dropping the baton. There are so many people doing incredible things in this state, but we don't practice the handoff. In Dixon, Illinois, there's a great program, they call it Safe Passage. I love that. And the other thing I would say is that each and every person is so important, like each person. When I talk to my friends in recovery, I was asking them about their experiences, and one woman said to me it was her probation officer that was able to break through the shell. Another person said, it was 12-step meetings in the jail. She connected with one of her peers. Another person talked about, his public defender, right? I mean, every human is important in that process. So the next question is sort of like, what are we connecting people to? The clinics are closed, right? So there's nowhere to go. That's what we hear. The clinics are closed. Oh my gosh, there's nowhere to go. Well, yeah, that's true, and we need a greater investment in services. But we more likely need an investment away from the justice system to the community support system. We passively choose to spend money in the system instead of outside of it. That's a decision that we make. We have to do things in a more integrated way. I know Karen will probably talk about this a bit. Collaborative care, integration, working with telepsychiatry, all of these things can help us expand access. We still have a really highly separate and unequal system for mental health and substance use. Heck, we don't even have mental health and substance use in the office at our state level that does healthcare. They're in two separate departments. And in the end, this isn't really just a justice problem, it's a community problem. We need a thriving ecosystem. The Kennedy Forum did a really wonderful pilot that we're just finishing up on the west side, where we worked with community leaders. Community members really want to be involved in this process. We provided mental health first aid training and training that helped people understand if they were calling 911, how to access a CIT trained officer, and then how to access community-based services. And we've trained about 400 faith leaders, community-based leaders, and what am I forgetting? Oh, educators. And the results so far are really, really good. We're decreasing stigma, and people feel more empowered to ask for the right officer, and it's been really a joy to participate in that really collaborative process. And then finally, I just want to close by saying we really need to reach for higher ground on this issue. One person I talked to said we were in an existential funk. That is a much bigger problem than a lack of money. Anyone in recovery knows the only way out is hope and believing that it will and it can get better. Senator Booker said recently that cynicism is for cowards. And like many of us in this state, I find myself in that trap a lot. And no doubt it's going to take some courage to change things, but we need to find a shared purpose, and we need to infuse accountability. What's our goal? That every kid in the city gets connected to services? That no one leaves jail without a treatment plan and a place to live? Who's holding us accountable for this? 20 or 50 years from now, people are going to look back and they're going to judge this. They're going to judge this moment in history, just like they did with the global AIDS epidemic. And then it was ground zero was Africa, and today it's the United States, and a lot of people would say it's actually Chicago. So yeah.
Thank you. Final panelist today is Karen Teitelbaum. Karen is the president and CEO of the Sinai Health System. Sinai Health System is it's a teaching healthcare system comprised of 4 hospitals, an epidemiological research institute, I think I got all those syllables, focusing on healthcare disparities, a community institute with over 25 distinct programs, 800 medical staff members, and 4,000 employees that's focused on the delivery of high-quality services in an efficient and cost-effective manner. Ms. Teitelbaum serves on the boards of the Illinois Health and Hospital Association, Women in Health Life Services, the David Lynch Foundation Advisory Council, and has served on the boards of the Metropolitan Chicago Healthcare Council, Family Health Network, and the Therapy Institute. She's a member of the Economic Club, the Chicago Network, and the Commercial Club. She's taught both graduate and undergraduate courses in managed care and marketing and strategy for nonprofit organizations. She has been named one of the 130 nonprofit hospital and healthcare system CEOs to know by Becker's Hospital Review, as well as being named one of the leaders of Chicago healthcare by the same publication. She holds her Master's in Management from Northwestern University, the Kellogg School. Ms. Teitelbaum.
Well, thank you. Thank you. So despite all of that, I can't stop thinking about Kelly being the high school baton relay. I was thinking, but all I was twirler captain. I can't even say anything that relates to that. So thank you very much. Thanks to Nneka and Kelly, because I think it's abundantly clear by now, even though you just heard two of us, that nobody in Chicago, and I think nobody anywhere, can tackle this huge issue on their own. It's all about the connections in the community. And so let me give you a little bit of context for what we're doing over at Sinai. And when I tell you the first few statistics, it would be very easy to say, gosh, I mean, to Kelly's point about being cynical and feeling like it's too much of a lift, how do you go on? But then I'll tell you what we are doing and what we're doing in part with many partners, many of whom are in the room today. And that's what gives us hope every day. Sinai, and you've heard the parts that comprise Sinai, what wasn't said was that we currently see 70% of the folks that we see are insured by Medicaid. It had been hovering around 60, 65%, and then with the Medicaid expansion through the Affordable Care Act, more people were covered. So we have 70% of our patients are Medicaid. We have another 20% or so who are Medicare, so you can see we're very dependent on the government. We had, for a very long time, about 12% of the people that we saw absolutely no pay in our communities. And with the expansion, again, of the Affordable Care Act, that number has gone down slightly, but it's still a struggle if you see what our payer mix is. And the rest is comprised of maybe some PPO, I always say, me and my boys, and it's a very unusual system. We are the largest healthcare system that's a safety net provider in Illinois, and we've been around for about 100 years. So. We really serve the most, what I think, inarguably is among the most vulnerable communities in Chicago, certainly if not in the state. In our communities, let me just give you sort of a snapshot. And for me, not having worked at an urban healthcare provider before I came to Sinai, even though I've been in healthcare in Chicago my entire career, it was just aha after aha moment that when I started realizing how all of the impacts of day-to-day life in our communities really trickle down quite quickly to the health of a community. We have many challenges. We have in the communities that we serve up to 7 times the unemployment rate as you'd find in the rest of Chicago. We have 3 times the prevalence of chronic disease. We have 10 times the national homicide rate, 3 times that of Chicago. We are a Trauma One center. But you start to see if people aren't employed, if they don't know where their next meal is coming from, they don't have a safe and accessible place to live. And those very issues are part and parcel of those who suffer from a mental health illness. You're certainly not going to worry about coming in for your mammogram or coming for your prostate screening, the kinds of things that keep you healthy. So it's all very connected, what we deal with in the community. We have our Sinai Urban Health Institute, which is our research arm, and focuses on, as was mentioned, healthcare disparities as one of the major areas of focus. And we just recently released, I think many of you are aware of this, huge, I think it's the biggest door-to-door 500-question survey of 9 communities and their health. So really we're able to get deep into all of the issues that impact the health of a community. And here are some of the statistics, and again, it's related to the very topic we're talking about today, the intersection between health, mental health, and the criminal justice system. In the communities that we serve, we found that there was a reported or diagnosed depression at a rate of, in some communities, 18%. Let me put that in perspective for you. The prevalence in the United States is 7%. So this is right in our own backyard. For post-traumatic stress disorder and, witnessing violence as well as being a victim of violence, we have a higher rate of PTSD in the 9 communities in many of the 9 communities that we surveyed, higher than if you were a returning vet from Afghanistan. This is Chicago. This is our Chicago. And I will tell you that I believe that all of Chicago cannot be healthy and productive as long as we have this going on among our communities. So I've told you about the rate of depression in terms of arrest. In 2 of the communities that we surveyed, North Lawndale, West Englewood, greater than 50% of the males have had a brush with either being arrested or being convicted, but have come in contact with the criminal justice system, more than 1 in 2. In Humboldt Park, more than 1 in 3 of Puerto Rican males have the same issue. And so you start to see how all of these issues come together, and I think Nneka said it very well. We have people coming to jail as a place to receive services, and we all know that jail is not acceptable for that. So, boy, that's really, that can be overwhelming when you really start to think about those huge challenges, and it's not just one issue. So despite the challenges, though, what has Sinai Health System done? We've really decided that while others have closed, I think, Nneka, you mentioned that a number of facilities have closed, and we all know that in the community. We've gone the opposite way. With the Affordable Care Act, we were able to take dollars that came through the Act and reinvest them in the community. And there's going to be some articles that will be handed out on what we're doing. I think that they ran the Trib and the Sun-Times and Cranes on what we're doing for the community. We've made investments in behavioral health. We've seen studies that show that for every dollar that we as a society invest in behavioral health, we save $3 on the criminal justice end. I don't know, that seems like a pretty good investment to me. So some of the things that we've done, there was no inpatient mental health services, there was no psychiatry unit in the Marquette Park area for as much as 5 miles around us. We had people coming to our emergency department in a behavioral health crisis, staying in an emergency room because we could not find a bed for them if Mount Sinai Hospital was full. We couldn't find enough beds for the people coming to Marquette Park to Holy Cross Hospital. People would be sitting for as much as 3 days in a behavioral health crisis in an emergency department. That is just not right. So we've opened up a new inpatient unit where there was no services in that community before. We've opened up an outpatient services unit that we'll see once we're ramped up, 500 visits weekly. Right on the campus there. I think the most exciting thing to me was opening up a crisis stabilization unit, Chicago's first crisis stabilization unit. So what is that? That's a unit that's right now on the campus of Holy Cross Hospital. Rather than being taken to the emergency department, which we all know is not the best setting for somebody in a behavioral health crisis, the crisis stabilization unit there aren't even gurneys there. It's chairs, recliners. If you're a patient, you don't necessarily have to get out of your street clothes. We're going to bring the team to you. We're going to make sure that you get your medical attention, that you get your referral so that when you walk out, you're safe and you have a next step in the process, and Kelly talked about this step 0. I think that you said it very well, Kelly. So we're going to make sure that you have that. We're going to make sure that you have your medications. So we've been operating for a little bit more than a year. We've seen over 2,000 people. 81% of the people who came to us through an emergency department came with some sort of concomitant mental health, substance abuse issue, so we've been able to connect people there. We've brought down the waiting time in an emergency department from 18 to 24 hours down to about an hour and a half to 2 hours spent in the emergency department before transfer to a more appropriate setting, which would be the crisis stabilization unit. We have a very strong relationship with the Chicago Police Department, with the Sheriff's Office, and I just looked at the statistics since we've started that partnership, which started in January after we opened the crisis stabilization unit. We have seen, on average, at least one person from connection to the Chicago Police Department every single day, 7 days a week, since January, and we expect that to ramp up. So we've got a lot. I know we've got questions from the audience, and we're going to have more talk as a panel, so I'll just stop there. But I think that there is hope. There's hope with our many partners in the room, working with our federally qualified healthcare center partners, Lawndale Christian and Chicago Family and Access and Esperanza and many others, to make sure that we're integrating the primary care with the specialty care, with the behavioral health, because it is, Kelly, I'm going to steal your ground zero many times now. It is ground zero. We have to do it in the community. Thank you.
Thank you very much. Okay, we have a number of questions already. We're going to try to get to all of them. If we have some more, Amanda's here to collect them. I'll start off very quickly. Mel Katz, City Club member. Where's Mel? With AARP Illinois, what is the average cost of incarceration compared to the average cost of mental health hospitalization?
I can answer the first part of that. I'm sure Karen can answer the second part. So the cost of incarceration for someone with no mental health services is about $170 a day per person. And then when you look at the expenditures from medical and mental health services, then that can triple or even be higher. And please note that with those more than 2,000 individuals in the custody of the Cook County Jail that are receiving mental health services, many of them over the course of time have been coming through our doors several times. And so what we're seeing is that many of them have come sicker and sicker as time has gone on. And so that means that the cost is that much higher.
Okay, and for hospitalization, depending on how severe the illness is, I think that we could probably figure that perhaps $1,000 a day.
Okay, Rosalind Young of Project 180 Chicago. Rosalind, is it possible to create a resource guide for local businesses to display for their patrons?
A resource guide in terms of service access, what services are available? Is that the question? Well, yes, I think that's absolutely possible. I guess I would say that, and there are lots of people that have developed resource guides. I guess I would say that I think the state and the city should be developing a hotline and a resource guide that is centralized with 24/7 access to clinicians who can refer people into services.
Yes, there are a number of resources available in the community, many of you representing many of those agencies. You know, what we found at the jail, unfortunately, is that there seems to still be a lack of psychiatric services. And we know that that's paramount, again, for people coming into our custody that are sicker. We're releasing them and they're at a much stable point, but you want to release them in a manner by which you know they're going to have an appointment in the community within the first couple of days post-release, because that's a critical point in someone's well-being. And so, yes, there are resources available. NAMI website has a number of them. Mental Health America, a number of agencies have resource guides that are easily printable.
Okay.
But I think it's more than just having the guide. As Nneka's pointed out, the guides are there. I think it really goes to the recognition that and it's not only somebody recognizing a problem in somebody else, but it's self-recognition, and then of course removing the stigma and making it natural to talk about. Sinai Urban Health Institute several years ago did an interesting study where, again, it was in the community, and we compared. Asked people just to answer a simple 5-point clinical, just an identification of could you be at risk for depression, then to self-diagnose, if you will. Do you think that you have a clinical issue? And as you might imagine, what came out on the objective clinical scale was here. What came up on the self-diagnosed was here, and I think that that's still a very relevant problem.
Deanne Barrios, who's a member of the City Club. Where are you? Deanne, did I say that right? With the Women's Justice Initiative. What is your position on addressing the unique needs of women versus male populations, and what are you doing about it? Anyone?
Yes, so the most important aspect for female services is trauma-informed care. And so we require that of any agency working with our female population. We also, like just for our male population, but we have assessments for our female population. Unfortunately, and this is the reality nationwide, we're seeing more women coming in with higher rates of mental illness than in our male population. So on average, usually males coming into correctional institutions, about 16% of them would have a mental illness. With women, that's double oftentimes. And so we know that a lot of it is related to, again, the histories of trauma. There is also significant substance use. And so, the focus is on trauma-informed care and making sure that we include the family aspect, not just the patient that's in the room with us.
Just a quick comment on that, too. I think the Governor's Commission on Justice Reform, which is, I think, a really important, good step forward, and recent legislation, also great step forward, included a goal to increase the incarceration rate by 25%. Great goal. The challenge, I think that we have is that we should really think about that in terms of special populations, because the risk we have is that guess who ends up in jail? Women, African Americans. You can reduce the incarceration rate and not address the deep disparities that we have. And so I'd love to see those goals be more specific in terms of populations that have special needs.
And I think that another key is also making sure that services are integrated, that they're close by and easy to get to. We are opening up with Esperanza and Las Mujeres, which is one of the largest social services agencies serving the Latino population in Brighton Park. And we are co-locating all of our specialists. So we know that there's a high number. We found this again through the Sinai Urban Health Institute Community Health Survey. We know that there's a very high proportion, in fact, it was a shockingly high proportion of people women who are reported being domestically abused. And so we want to make sure that the services for counseling are there, again, out in the community.
Lawrence Masal, a City Club member and the head of the Civic Federation, is here, and he has a question specifically, I guess, for you, Karen. What role does private philanthropy play in mental health services and research compared to other chronic illness research and treatment at Sinai historically? Mm-hmm. And does the mental health stigma affect government and private mental health resources?
Okay, so really kind of two questions there. Thank you, Larry. You're making me work overtime. I think that there is really a great opportunity for us, and when I say us, I don't just mean Sinai, but I mean for the entire community serving mental health needs. We need to be unafraid to have those conversations about supporting mental health. I think that there has been a huge stigma and a great deal of silence. So I think that this would be the time for us to really start ramping up And again, when I say we, I mean the large healthcare provider community. But it's a time for us to step up and say we need the support just as we need it for diabetes or oncology. If not, we're behind the times. We need it even more. Could you repeat the second question about resources?
The second question was the stigma of mental health. Does that affect funding from governmental and
oh, that's interesting. I never thought about it that way. Personally, I think maybe I would turn to Kelly about that. I don't believe that the stigma of mental health impacts government funding. In fact, I applaud Director Norwood, who has been very, very focused on behavioral health and in applying for the 1115 waiver, which I think puts appropriate focus and would give us a different kind of way to apply resources to behavioral health. So I'd have to say, in my opinion, Larry, I would say no, but do you feel that there's...
You know, I don't know. I do think that right now, especially locally, I would say that a lot of the philanthropy is focused on supporting and shoring up some of the access and provider shortages that we have in the city, which they should. But I think one of the challenges that, as I mentioned, huge part of the problem is the connections and the relationships and the collaboration and policies, and those are different. You know, those have not gotten the priority I think that they need right now.
Janine Stevens, member of the City Club. Janine, where are you? Somewhere in the middle? Please tell the audience what they can do to contribute to a solution rather than just describe the problems. Can you become a volunteer at the Cook County Jail?
Well, out of those 200 plus programs that we have at Cook County Jail, they are mostly run by people that are volunteering their time to come into the jail. So yes, you can come to volunteer your time to partner with the Sheriff's Office to provide services to the population. And not just our mental health population. We have over 7,000 inmates in our custody today, and I would argue that all of them could benefit from social support services and just knowing that they continue to be a part of the community, even though they're at 26 in California. And then to note one thing that, we can do, in highlighting many of the things that we're doing at the Sheriff's Office, I hope to draw an analogy to what we should be doing in the community. There are many things that, anyone here in this room can do. I would say advocate. Mental illness, unlike chronic medical illnesses, is very much a young person's disease. Most of mental illness is diagnosed early on. And with that being said, I would suggest that we begin looking at what services are available to school-age children, and those especially that are growing up in neighborhoods that have increased violence, because we know that trauma is playing a large part in our communities, and we want to, try to mitigate this crisis as much as possible. And until we begin offering social supports in those neighborhoods, it's going to be very difficult for us to really battle this crisis.
On the advocacy point, can I just say that I also think that we should be asking our leaders to make this a higher priority. I mean, the state of Maryland declared a state of emergency over the opioid epidemic. The state of New York, the mayor of New York has made this one of his top 3 priorities. We have just not expressed this, the urgency, and we haven't made this issue as a priority. And I think we really have to ask our leaders to do that.
Bill Houston asked, what has your experience been with online mental health providers?
Is the question telepsychiatry? I'm not sure. No, you're really talking about online?
Yes.
Okay. I think, I think that it's very hard to, I think that there's a place for that. I think that it's very hard from a clinical perspective to know who's on the other end of the line in many cases. I'm a big advocate for standardization, certifications. So when there's a recognizable certification, accreditation, I think that that's a great resource. I think that there are a lot of online quote unquote resources that are not helpful. because there really is no, you can't justify what the training is.
Laura Cianci, jobs for dyslexics. What are we doing to prevent the problems before they develop? Nneka, I think you were just beginning to touch on that, but.
Yeah, I mean, our numbers at Cook County Jail show that we're not doing much. I just spoke about some of the things that I hope that we begin or continue to look at. And again, it's offering, interventions, early education, and not just early education, because understanding we have a large population of people now that are incarcerated, whether it's Cook County Jail or Illinois Department of Corrections or nationally, we also have to look at what they're going to in the community, not just with respect to mental health services, but comprehensive services, housing, jobs. I mean, one of the primary, reasons that someone aspires to be healthy is to be independent, and that means that we want to take care of ourselves, we want to take care of our families, and that requires, again, more than just mental health treatment. That requires comprehensive care.
Okay, this being the City Club, we're well known for our sandbag questions, and so we'll close with Brent Hoffman, City Club member with the Chicago Architecture Foundation, who is asking, when will Tom Dart announce that he's running for mayor of the city of Chicago?
And you're in charge of answering that.
How do you turn off the mic? I wish I could answer that. Unfortunately, I can't.
Okay. Please join with me to thank our panel for focusing our attention on this incredibly important problem.